Hey, it's Brian from Strong Tower Training, Neuro Coach. I'm back with a carpal tunnel relief segment today. So this is for you if you've had carpal tunnel issues in the past or currently dealing with. Check always with the healthcare provider, so get that off the table first. Want to make sure that you're working with a qualified healthcare professional who's cleared you to do some movement. That's taken care of. Or if you're just somebody who's never had carpal tunnel, never had that syndrome diagnosed, but you've had some discomfort in your forearm or your elbow, or you've had grip issues where you want to swing a kettlebell better, pick up a barbell better, maybe do better pull-ups, this might be for you too. So what I want you to do today is test. As usual, we're going to test something, in this case wrist extension. So I want you to go to a wall or a doorway. We're going to slowly walk the hand in question down the wall and check our range of motion. So in this case, I'm going hand down the wall. And when I get to right about there, it gets a little bit uncomfortable, so I'm going to stop there, and that's my point to come back to. And I know where that spot is on the wall with my whole hand, fingers, and palm pads here all the way up against the wall. So from there, we're going to do a little bit of massage work. And so what I want you to do is find your carpal tunnel. It's on this thumb side of the wrist, and if we go into that little groove there, just gently massaging, stretching the skin really up and down as if you're tracking it up and down the arm a little bit, okay? So gentle massage there, especially if it feels good. If it hurts, you may go to the other side or just ease up on the pressure a bit. Then the second place to massage is in between the webbing actually. So the webbing in the fingers between the middle and pointer finger, as well as in between the thumb and the pointer finger. So I'm just going to give some gentle massage pressure. I'm wiggling my fingers that I'm doing the massage with to create a little bit of stretch in the skin and some traction there, bring some blood flow into the area. The second piece of this is a brain activation. So we're going to use the brain to influence the body. If you've been following us for a while, you know that's one of the main things that we do and love to help people in unique ways. So now we're not doing anything below the neck. This is just your brain, your cranial nerves working with you. So we have this fancy training device that's called a pen. I'm going to use my pen to bring that in towards the nose, and I'm just staring at it. So my eyes are going to go a little cross-eyed here. I'm staring at the tip of that pen. It should stay as a single target as I do that. Make sure you're breathing. Make sure you stay relaxed while you do those pen push-ups. Now we're going to go back to the wall and retest. And for me, that's better. So I actually got more range of motion, went about an inch or so further down the wall. Less discomfort, even with that further press into extension and that range of motion. So that's a good drill for me. If it is for you too, practice that one. You might use it before your workout. You might use it consistently if you're using the mouse a lot, and that gets a little bit uncomfortable for you throughout the day. This next exercise we're going to work on is a median nerve, that's the carpal tunnel nerve, stretch. And so what I want you to do if you're in pain, if this is like an acute pain situation where you're actually experiencing pain or discomfort in the carpal tunnel area, go ahead and again, check with a healthcare provider, reiterate that. But if you can move a little bit, we're going to slack the painful side. And what I mean by that is the nerve can stretch, or it can actually go under less tension and slack like a rubber band getting crumpled up on itself. So on the side that's uncomfortable, you're going to actually make a closed fist, bend the wrist, bend the elbow, shrug the shoulder a little bit. So we're just letting things actually calm and quiet down on that side. On the other side, we're going to stretch the nerve. So if it's not painful on that other side, we're going to extend the wrist, open the fingers, lock the elbow, gently press the shoulder down. And then from there, I might do like some gentle side-to-side head tilts. So I'm laterally moving the head and neck, getting a little bit of cervical mobility if that feels good. And we go for maybe 10-20 seconds with that. That's if you're in pain. Then we're going to go back and recheck and see if that pain or discomfort in the involved side gets better. So I worked down probably another inch or so, and I'm pretty much discomfort free in that deeper range of motion. So again, a good useful drill for me to work on personally. If it helped you, please practice this one. It's going to be beneficial for keeping that median nerve healthy. And the second iteration here is if you are pain free and you just want to get better grip, you might actually go to both sides, do a little bit of a gentle nerve stretch, and then you could also do that on the other side, or you could do both together and get a median nerve stretch bilaterally. Then going back, we're always going to retest. You might retest your grip or the one we've been using. And I'm even deeper into it there after stretching that side a little bit. So working into just a deeper range of motion if that's possible for you. Again, that would be another good drill for you. So hope you practice, and remember to subscribe to the channel, like the video if you didn't yet, and we believe that it helps to know our neurology.